health professionals. Probably you know my name, but for those who do not know me, my name is Sajjad Hussain. I'm a senior prosthetist orthotist, having almost 24 years clinical research and teaching experience in the field of prosthetics and orthotics. I thank you all for joining us and welcome you for this meeting. The main aim of this setting is to share some of the knowledge with you and to get your feedback, how we can aid more to improve it. And the ultimate aim is to improve our clinical skills towards the patients. I selected an important topic. Sorry for the little gap. We selected an important topic for today's discussions and presentation. It is related to the most common clinical symptoms, and almost we receive 60% of the patients having this common complaint, and majority of them are female. They usually can be due to overactivities of standing and walking, prolonged work activities, and maybe wrong footwear, which leads to the stress and stretch of the plantar foot muscles, which can lead to the pathology or pain. So the topic of my presentation is related to the heel pain, which is commonly called plantar fasciitis. And this pain is very aggravating, especially early in the morning when the patient takes few steps. And it's orthotic management. So we will go systematically. First, we will introduce the plantar fasciitis, its pathology, and then function of the plantar fascia ligaments, then its signs, symptom, causes, diagnosis, and then treatment modality, especially with the braces or orthosis. Lastly, you are welcome to give feedback, discussion, or any questions, and with references. So I will begin first with the plantar fasciitis. What is plantar fasciitis? Actually, itis, it is the inflammation or infection of the plantar fascia at its origin. Plantar fascia is a ligament, and expanded. It initiated, started from the interior medial tubercle of the calcaneus, propels forward, and then expands and attaches to the proximal bases of the distal phalanx. So this is very important ligament which has more function in the foot when we stand, walk, or run. So the pain is usually due to the inflammation or infection at the origin where the plantar fascia tendon or ligament is inserted at the base of the calcaneus tubercle. So this is the most common orthopedic issue or complaint at the foot, and the patient is always complaining that they have pain in the heel, and it is more worse in the morning. So this is the typical symptoms for the plantar fasciitis, and we should isolate this from the sciatica pain, which is also related to the big toe. When it extends, it starts pain. So plantar fasciitis is actually related to the heel pain, which is the inflammation at the area of the attachment of the plantar fascia tendon. The theory says that due to any rigorous activities, prolonged walking, or the athletes who do running, jumping, and lots of other activities, that leads to the stress fracture of the ligament area here. So there's a slight fracture occurs, and this fracture is termed as avulsed fracture. Avulsion is actually due to any stress, small piece of the bone fragment is also fractured along with the ligament. So this is the condition which starts inflammation and pain. So it is radiated almost around the plantar sole of the foot and mainly to the areas around the heel. It can either be unilateral, in which one foot is involved, and can be sometimes both feet can be involved, so can be bilateral too. And I said before that most common complaint is occur in the female rather than in men, and can be due to wrong footwear, prolonged activities, or due to overweight issues, which is termed as obesity. So this is slightly related to the pathology. Then we will move to the functions of the plantar fascia ligament. So ligament is the connective tissue that joins or connects bone to bone. So plantar fascia is the ligaments that connects heel bone to the proximal bases of the phalanx. The main function of the plantar fascia is it helps to maintain the medial longitudinal arch of the foot. And these arches are helpful in standing, walking, and running. Plantar fascia also acts as a shock absorber, which absorbs all the stresses when we walk, when we run, and when we move to do the daily activities. Also, the plantar fascia supports and maintains the arches of the foot. So these are few of the important functions of the plantar fascia. It also helps us to propel forward, and it helps us in walking, running, and in jumping. So it's brief. So the next slide is related to the signs and symptoms. So when the patient we see in the clinic, they come with a common complaints that we see as a symptom. But when we observe, we term it as signs. So plantar fascia is the inflammation around the heel. And when we see that it is inflammation, so it will have these four signs like Keller, rubor, and Delor. Keller is related to if we touch that part, it will be hot because of the rush of the blood over there. There will be redness because of the accumulation of the blood, and there will be swelling. That area will be edematic, and there will be pain. So this is the common signs of the inflammation, and also there is limited function because the patient cannot stand, walk due to the pain. So there is a functional loss due to the plantar fasciitis. So actually, the patient complains that early morning they have very much pain when they take few steps. And one of the theory is that because there is a fracture occurs, and that avulsion fracture leads to heal overnight. So there is a callus form in the overnight because the foot is relaxed. When the patient early in the morning stands under the weight bearing, the arch stress and the foot collapse, the arches collapses. So the callus which is formed, that is fracture again. So it leads to the pain. So initial few steps which the patient takes, it is painful because the callus which is formed, it has the nerve innervation, so it breaks and it is very painful when the patient takes few early steps. And that's because of the breakage of the callus, which is formed overnight relaxed position. And the aspect or the site of the pain is normally around the heel, but it can be radiated to some other part around the heel. The patient can touch medial, lateral, or posterior aspect. So it can be because of the pain can be radiated anywhere around the heel. So the patient has complained, but it is actually the plantar fasciitis. And the nerve which is involved or entrapped is the Baxter's tibial nerve of the sciatica. So this is the nerve which is involved in this pain. The pain is under weight bearing and walking, and upon it is more severe when we touch that area. So upon palpation, the patient feels pain. So these are few of the signs and symptoms of the plantar fasciitis. Then the causes can be many. I brief a bit of that. It can be due to wear and tear of the plantar fascia ligament due to any reasons. For example, if the person is doing rigorous activities of running, jumping, or the army people who strikes the floor, so the stress fracture occurs. It can be also due to overweight or obesity reasons. And sometimes it can be due to also the wrong footwear. If especially the female, they uses high heel shoes. So with high heel, the plantar fascia stretches too much and it can lead to the fracture of the origin area. So it can be due to wrong footwear or high footwear heel shoe. It can be also to the work-related or job-related pathologies, the people who are doing a lot of walking or standing jobs, so the stress fracture occurs there. Sport-related activities, just like athletes who are running, jumping, or the army people who are doing the march past, they most commonly suffer with the plantar fasciitis. The next reasons can be due to degenerative changes. One of the example is osteoarthritis. So the bone structure is weak and it can lead to the fracture. And next is the people who are very active beyond the age of 50 years and they are doing prolonged rigorous activities, they can be also more prone to this plantar fasciitis. Females are more affected due to many reasons as explained. And if it is not treated earlier, the fracture and healing of the callus, it can lead to osteophytes, which is the outgrowth or heel spur, and it is a very painful condition and the patient cannot stand anymore. So in that case, either they will do shoe modification or surgical intervention can be done if it is not treated for even after 1 or 2 years. So the heel spur is the most severe pathology related to the plantar fasciitis. So there are a few steps that can lead us to diagnose if it is plantar fasciitis or due to any other region. So first is that we can take a full history, past medical history, social history, and activities related to the hobbies, jobs or work. So they can lead us how the patient life is that. So we can identify that if the patient is doing sports activities, running, so it can lead to this plantar fasciitis. So we confirming that yes, it can be due to these. There can be also other physical examinations, which is the palpation of the area, that is the box-tibial nerve. So we can dorsiflex the toes and touch the area of the interior tubercle, and then if we dorsiflex or if we palpate, then the patient feels pain and the pain aggravates. So this can be also the confirmatory test for the plantar fasciitis. And next is the vein loss test for toe extension, and with toe extension or standing on the toes, the patient feels pain. The pain increases because of the stress on the area of the origin. And then it can be also due to certain foot deformities if the patient is affected from flat feet or planus feet or hollow feet, cavus feet. It can also be one of the reasons that it has plantar fasciitis. And we can also palpate and check the inflammation if it has the 5 reasons that it is red, it is hot, it is swelling, and it is painful. So it can be another. If it is not still yet confirmed, then we can do MRI or X-rays to confirm that it is plantar fasciitis or heel sprain. So these are the few tests that leads to our diagnosis that the patient is suffering from plantar fasciitis. Treatment modalities can be many because initially we said that if the patient has not that much, we advise them to take some rest, and with some medications it can heal. But if still it persists the pain, then from medicine treatment we advise physical therapy also, which can exercise, physical therapy. Exercise the muscles, it can improve the blood circulation, and then the area of inflammation, it can be healed. So they can do non-invasive treatment for plantar fasciitis. They can do exercise just like rolling of the ball or rolling of the cold water, or if they can exercise all the plantar and dorsal aspects of the foot muscles to activate, and then it can improve the blood circulation and improve the healing of the inflammation. So physical therapy is very important. Next is conservative treatment, which is with the help of orthosis, either in rest position or in stress position, a night splint, so it can also improve the healing of the inflammation. And lastly, if all these conditions are failed because due to any reasons, if the patient is not treated, then surgical intervention is the last option to treat the plantar fasciitis. There are also certain anti-inflammatory drugs and ice bottle massage, which is related to physical therapy, rest and immobility, and to control the weight. So the patient who are suffered from the obesity or overweight issues, they have to control their weight so that there should be less stress on the foot. Physical therapy helps to stretch, improve the blood circulation, leads to prompt healing, relieve the pain, and also strengthen the muscles to keep the maintained arches. There are certain injections that can heal the pain or to absorb the inflammation. Corticosteroids injection can be also used related to plantar fasciitis. And lastly, which is the most important and which I will discuss